My name is Daniel Lewis, and this is the intradermal injection. So first thing I'm going to do is verbalize the 6 rights of medication administration, which is right patient, right medication, right dose, right route, right time, and right documentation. And then I will perform hand hygiene. Um, and then I will gather my supplies. In this case, I need my intradermal needle, and then I'm going to check the physician orders in the MAR. So for this, I'm going to be doing the Mantow 0.1 milliliter intradermally. So first thing I'm going to do is check the vial for any cracks, check their expiration date, and this one is good. So I'm going to open a alcohol pad and clean the top of the vial. All right. I'm going to allow that to dry. While that dries, I'm going to open up my intradermal needle, which in this case is a 28 gauge half-inch needle. So I'm going to uncap it. And for this, again, we're doing a 0.1 milliliter, so I will pull back 0.1 milliliter of air. Alright, right there. And then I will insert this into the vial and inject the 0.1 milliliter of air, and then flip it upside down and withdraw the medication. Alright, there I have 0.1 milliliters, and then I'm going to use the scoop technique to recap the needle. Alright, and then I'm going to go to the patient's room. So I'll knock on the patient's door, knock, knock, knock. My name is Daniel Lewis. I will be your student nurse today. First thing I'll do is perform hand hygiene. And then I will ask the patient for their name and date of birth. So they tell me the name, correct name, correct date of birth. So this is the right patient. So I'm going to go ahead and explain the procedure to them. So we're doing a TB test, so I will explain to them that I'll be doing an intradermal injection on their right forearm, and then they will have to come back in 48 hours to have that read. So before I do that, or before I do anything, I'm going to put my gloves on. All right, and then at this time, I'm going to ask the patient if he has any allergies or anything like that. He tells me no, and then I'm going to verify that it is, again, the correct time, dose, and medication for this patient. So now that we have the patient sitting down, I'm going to take an alcohol wipe and clean the area that I'm going to be doing the intradermal injection on, using a small circle, starting in the middle and working my way out. And then I'm going to allow that to dry. And I'm going to, well, still drying, but I'm going to uncap the needle. And with this type of injection, I'm going to make sure the bevel is up, and I'm going to hold the needle between a 5 and a 15-degree angle. So I will have the patient, and I will pull the skin back slightly, making sure the bevel is up, and I will inject it, or insert the needle about 1/8 of an inch, just enough to get that bevel under the skin, and then I will slowly inject the medication, which will cause a slight, well, it just popped with this thing, but it would be under the skin. And then I don't have a sharps container right now, so I'm going to go ahead and cap the needle. Um, and then I will take a pen and draw a 1-inch circle around the wheel on the skin. I'm not actually doing it because this is the school's property. But anyway, draw a 1-inch circle around the wheel, and then I will instruct the patient that he needs to come back and have this read in 48 to 72 hours to see if there is a reaction. And then at that time, if there is a reaction, I will measure and record the reaction. And once I'm done with this, I will go to the MAR and I will document, including the dose, the site, and when I did it.